Jesus slept in the storm. I mean, come on. The very Messiah, he slept during, like, clearly he prioritized rest. So it's scriptural is a good thing, and it's not a selfish thing. And that's why we're having this conversation. It's an awareness thing. So sometimes you have to be reminded of the things you know to do, but don't do because you don't have someone to tell you, to encourage you, or you feel you're an exception. So this conversation is a friendly reminder, like, you got to practice what you preach.
Hello, everyone. This is Dr. Nita Wanga. I'm here with my friend, Dr. Tolu Olabintan. She's a family medicine doctor located in Texas. Her focus is on lifestyle modifications. She is an incredible physician. Not only does she do the medical part, but she helps her patients with their mindset, with improving their lifestyle so that they can improve their health. So, Dr. Tolu, please tell me a little bit more about yourself, tell our audience about yourself, and tell us a little bit about your journey to becoming a family doctor.
All right. First, thank you for the privilege to do this. Honored, your friend, your sister. So I'm really delighted to be on here. So yay. And a little bit about me: physician, mom, wifey, Christian, a lifestyle physician, big on helping people live long and well. So that's a passion project of mine. It's what gives me every day. And as far as my journey as a physician, before I forget, I'm also a foodie. I enjoy eating. Okay. Because sometimes when I discuss healthy eating, people think, oh, you must not eat. I do enjoy eating. But back to the question at hand, as a physician growing up, knew I like taking care of people, wanted to be a nurse. The uniforms were cuter. Grew up, realized that, the doctors tell the nurses what to do and has more of a say in that care. And so that became the path for me. So always knew family physician. I met a doctor who actually took care of multi-generational family members, the grandparent, the child, and then the grandchild, and then circumcised the great-grandchild. So I was like, man, I like that. Can you imagine the impacts you can have helping the family on all of those levels? So it became part or branch of family of medicine that I wasn't aware of. And so did family medicine, been doing that now for almost 16 years. And while I love the gift of medications and how far science has taken us, I also, pivoted a little bit to add the lifestyle aspect as well. So how can we use our habits, our foods, our environment to help improve our quality of life? And so started to practice 3 years ago, and here we are, still doing the things.
That is amazing. And I can't believe you only started 3 years ago. Like, you are doing amazing things. You've come so far in, such a short period of time. And I love the story that you're telling about one of the physicians that mentored you and how his ability to touch multiple generations is something that you felt, you were perhaps called. I don't want to put words in your mouth, but I kind of got the sense that you felt that, this is part of your calling. So that is really, really special to have that direction in terms of choosing your specialty. And then the lifestyle portion. Tell us a little bit more about why you leaned into that.
Now, before I answer that question, it was a she, Dr. Duncan, because I don't want to steal her credit. She was phenomenal. So shout out, Dr. Duncan. Now, the lifestyle piece, I'll be honest with you, for a while, I've had this doctor guilt about, I feel like I could be doing more for my patients. Like, I felt bad, like everything was medications. And don't get me wrong, I love that we live in an era where medications are an option. But I'll give this story that really kind of did it for me. It was, I think, 6 years ago, I started a patient on statin, and she had liver failure from it. Thank God I checked your LFTs, and we caught it in time, but it became something she had to struggle with, the hepatologist and all of that. And it started after statin was introduced. So I was like, what if I could kind of help her eat her way out of high cholesterol by encouraging that? And so it was a hidden guilt. I thought I was the only one who struggled with this. And so I would do things like sit with my grandma, who died at 93 before she died, who didn't take medicines, and ask her things like, okay, what do you use for this? How come you have all your teeth? And she would say she would take sugar. She had herbs she would make us drink, different types of berries she would blend, and leaves she would cook and have us drink when we were younger. It tasted nasty. Different topic, but and so before because I knew she was getting old, so I would sit with her and ask her for tips, like, what do you do for this? And try to take notes and see if I could replicate it here in the United States. Things like ginger for nausea, things like, hibiscus tea to lower blood pressure. So I became more, like, I got to do this. And then I don't know, I don't remember what it was. Like, I saw a post and it was somebody talking about lifestyle medicine. I was in a group, yes, with EBS. I was in a group, and it was a doctor, and she's like, I'm lifestyle boarded, and she does this. And I'm like, wait a minute. And then I asked her, we have a one-on-one, and she says, oh, yes. And then I shared, it was like a weight lifted from my heart. Like, it was like a hidden shame as a physician, like I could do better. And she's like, yeah, there's a whole school, there's a whole board. And I'm like, oh my God. So I took the path, took the courses, went for conferences, and my gosh, it was good I've been honest with you. It was refreshing to see that I started doing the things, but to see that there was a whole board of medicine that encouraged and taught effective ways to do it, man. So that's how that came about.
Yeah, that is amazing. I had no idea about this part or this path in your journey that, it stemmed from talking to your grandma. And I think I can relate to you. A lot of us as physicians, we prescribe things and people have side effects, or we wonder, is there another way to do this? And of course, a lot of our patients are like, I don't want to take medication. And then having that little dance that we do in terms of like, let's slowly get to this goal of taking this medicine. And it's like, yeah, having those thoughts in the back of our head, that's really incredible that you took initiative and you did additional training. So I'd love to talk to you more about that, but that is really, really amazing. So in terms of the next question, we're talking about life. So what is one thing that you think everyone should do in their lifetime? Or maybe if you as a foodie, what is one food that everyone should eat in their lifetime? Whatever you want to tell us.
Okay, so one thing anyone should do, I'll say for me, it's a no-brainer. Seek to encounter the God of the Bible. I got to tell you, that's my best big secret, like big. Now, as far as food, I think everyone should try plantains. The green, there's the sweet one, there's the green one. It could be sweet or not too sweet, but you should try grilled or air fry. Yes, plantains. That's it. That's my food.
Oh, you're making me hungry, especially the sweet plantains. Oh, yeah. But then the green, all of them are good. All of them are good. So going back to talking more about health topics. So family doctors are like the backbone of, the healthcare systems. They're the ones who spend so much time with patients. Of course, in the US, internal medicine, pediatrics, and OBGYN, we also do primary care. But I still think that, family medicine is the backbone or the foundation of medicine. How often do you think people should be following up with their primary care provider or their family medicine doctor?
I would say it depends on your, chronic conditions, medical conditions you have, family history. So the pattern that you want to check more frequently, right? So someone who has high blood pressure, diabetes, maybe not controlled, you may need to see the doctor more often. But in the least, I recommend annual checkups at every age. Now, of course, from the baby stage, usually that's more frequent. But by the time you get to age I want to say 5, at least every year. And what's the point of going to see a doctor every year is to get, a preventive screen. And I usually have this analogy as far as cars, and this may be lost in some people who are not big car people, but you have a fancy car. You're not going to wait for the car to break down before you go have it tune up or make sure everything is good. We're way, 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 way more valuable than the possessions we have. And so it's important that to keep ourselves in shape, to do the things we're created to do, it's important to have that form of care, right? We are our best assets. And so it makes sense to prioritize our health in doing the checkups. Preventive care, yes.
That is awesome. I really love that response and reminding people that, we're more valuable than all these objects that we have. Like many people take their car, at least if the seasons change where you are, twice per year. And then we're forgetting to go to the doctor. I'm also speaking to myself. I just had blood work done and I had no done in 5 years. I'm like, that is really, really important. And then going to preventative medicine. So tell us a little bit more about that for people who are not, physicians or in the healthcare industry. And they think, okay, I'm fine, I'm healthy. I don't, why should I go? Like, what is the doctor looking to prevent?
There's a desensitization because of what we do. We see really bad things. So you're not about to fall over, you're not having chest pain, you figure, I'm fine. So what, you're tired, hair's falling off, can't sleep or different, we're taught to tough it out. I'm amazed that I'm actually saying this because I'm used to be very much so one of those people. But in understanding my assignment and my calling and the things God wants me to do, I got it. Look, Jesus slept in the storm. I mean, come on. The very Messiah, he slept during, clearly he prioritized rest. So it's scriptural. It's a good thing, and it's not a selfish thing. And that's why we're having this conversation. It's an awareness thing. So sometimes you have to be reminded of the things you know to do, but don't do because you don't have someone to tell you, to encourage you, or you feel you're an exception. So this conversation is a friendly reminder, you got to practice what you preach. So you can, in fact, tell your patients that you should take care of yourself because you're practicing it too. Yeah.
So what are some of the medical or some of the preventative things that a patient might expect their doctor might tell them? Should they expect their doctor to be doing blood work every time they're going to see their doctor? What do these things change as they're, say a baby, an adult, and I know I'm asking you quite a very broad question, but I just want people to have the thought process as to a little bit more about why they should go and should expect their doctor to tell them and or do.
So here's the thing. We're not out to find something to get you. I get that. You guys are always looking for something wrong. That's not our agenda. Our agenda is what, based on what we know now, can be treated and prevented if caught on time on age, lifestyle, family history, where you are, like all of that. We make informed planning or informed decision based on those questions or those different factors and say, you know what, based on this, let's do this. We're not out to get you, you know. For instance, I would prefer to catch pre-diabetes before it gets to diabetes. I have this thing where I really would love to not have diabetes off your chart on your chart. So A1C is abnormal, let's say 6.5, you've crossed it. I'm like, whew, this is the first time we're doing blood work. We got 3 months. Let's fight it with everything we got. We're going to eat healthy. We're going to normalize exercising. We're going to find creative ways to do this so you never have diabetes. Because with diabetes, you got to get the pneumonia shot, got to be on cholesterol medicine, got to be on blood pressure medicine to preserve your kidneys. You got to be seen every 3 months. You got to see an eye doctor. You got to check your foot. Already that comes with that diagnosis. So I want to help you not get there, right? So it varies per age, of course, as we talked about. But the whole idea is what can we do based on what we know? And you know, the truth is this, and I tell this to clients all the time. You never have to do what I tell you. You make that decision. You're the one who's going to swallow the pill. You're the one who's going to do the test. But I'm here. You came to me asking, what can I do to live long, to live well? So my agenda is to find those things, to fix it, to help you before it becomes more of an issue. Of course, you don't want to be in pain and then say, okay, I help you so you don't be in pain. You don't want a painful reminder not to be at this point again. So sometimes your blood pressure doesn't feel bad. Diabetes, you're fine, right? So you don't see the value in what I'm saying, but we've seen this over and over again. And so prevention is always better than cure. It's just sometimes the proof is not quite there because you never get to it, right? You never get to the bad point. So it can be a hard conversation, but we're here to support you and help you live your best life.
That is great. That is great. And for some of our patients who are very proactive, they're into prevention, they're into, modifying their lifestyle. What are maybe 3 things you'd suggest that they do to perhaps help prevent diseases in the future?
All right, so 3. Wow. Okay, let's see. Best ones. Number 1, move. Don't exercise. Just move. Okay. Exercise sounds like stress inducing. Move. Find creative ways to move. Make it fun. Batch it with what you need to do. So, example, you don't have to go to the gym, but you could take a walk, listen to music, or call somebody who talks a lot so you can get engagement while you exercise. So it doesn't feel like work while you walk. So it doesn't feel like work. So find creative ways to work. And I tell this to my clients all the time. I said, find ways to work, to move or exercise on their time. So do it while you're at work. Standing desk, like cycling, like do it so when you're done, you've already done the work, okay, on their time. So that's 1. Number 2, make water a drink of choice. Yeah, water. You're 50 to 60% water. Drink water. Get familiar with it. Don't like the taste? Put a little lemon. Put a little cucumbers. Just drink it because it's good for you, right? So that's 2. And then number 3, plant-rich diet. Plant in its most unadulterated form. Unless you're, deathly allergic, then obviously no. But plants, where our body is wired to absorb them, to recognize them, and make good use of them. When it's ultra processed, then your body's like, I'm not sure what this is. And so it stores it in forms that are not quite productive or useful for you. So plants, your fruits and your vegetables, I recommend with every meal that there should be something just to get used to. So those are the 3 things: movement, water, and plant-rich diet.
Those are great. Those are great tips that can apply to anyone and are not necessarily expensive or cost prohibitive. I'm thinking of some of my patients who want to invest more in their health. Would you suggest that they take certain supplements to help prevent diseases, or would you suggest that they should be getting full body scans or certain blood tests to prevent disease?
How do you put a price on a human life, right? That's a tough question. If I could get a non-invasive scan that could predict things that could affect you down the line and could, yes, if it's not doesn't increase the radiation exposure to you, helps me find things that are preventable, I would love that in an ideal world. I would love that. So for those who are able to, I don't say get an MRI top to toe. I've had people come asking me for that. But there's some things you can do, check your carotid arteries to see if there's any blockage. So that may push you to make better decisions. Supplements, I'd be honest with you, yes. I went for a conference a few weeks ago, and, data is showing that between genetically modified food, our ultra fast process of producing foods right now, where the priority is we want to get it quickly. The soil is not as rich as it used to be. We don't use the cow dung and the poop from animals to fertilize. Now we have chemicals. And by the way, when you go to the grocery store, the fresh fruits and vegetables where they spray the water looking thing on the fruits, it's not water. It's chemicals to make the leaves look long, like fresh for a long time. So the same amount of, say, vitamin A or vitamin C or vitamin E that we got 40, 50 years ago from certain foods, it takes almost 20 to 30 times the amount to get the same quality. So there's a place for supplements. I'm a big fan. I'm not going to mention names, but I'm a big fan. There's certain ones I've done. I went for their conference. I see that foods like noni, acai, goji berries, elderberries, found in its most natural forms are put in bottles, no sugar added, nothing. So of course, taste like plants. And I've had people feel better taking it. I've had people get off medicines taking it. So yes, there's a place for worthy supplementation.
Yes, that's excellent. And I think there's still so much we have to learn about the body. And even within us as physicians, like we keep changing our mind. We keep changing our mind about this is bad for you, this is not bad for you, this is good for you. And part of the reason we change our mind is because of research. What we knew last year, last week, even yesterday, are out of date. So I think it's very important to change our minds and to be flexible and always to be seeking new knowledge. And I love how you're going to conferences and getting new information. I think that's extremely, extremely important, and applying the new information as we know it. And also, helping at the end of the day, our goal is to help our patients have the optimal health. And I think lifestyle is extremely, extremely, extremely important. And also supplements as needed to help us feel better, extremely important. And that scan, we need to create that scan so we can retire.
That'd be awesome.
One of these days. So what are some of the things you tell your patients? So for example, say, I'm just going to give you a scenario. You have a patient and they've been started, you talked about the lifestyle to help them, improve their blood pressure. You started them on medications and they're feeling very discouraged. Their blood pressure is not getting better. This is just a general scenario, but similar scenario. If you have somebody with diabetes, they're in the same scenario and, things are not getting better. They're getting discouraged. What are some things that you tell your patients to encourage them to, continue going down the path that they're going to improve their health?
I mean, it's a non-judgment zone. I'm not going to sit there really excited like, oh, numbers are still bad. Yay. No, but it's more, okay, how can I help you improve? What are big challenges? Are you taking the medicines? Any side effects? Any fears from taking the medicines? And one of the things I tend to do in my practice, I've gotten people off medicines, diabetes medicines, blood pressure medicines. I paint a picture of what's possible, but also paint a picture of the price. And it's encouraging consistency in the small or seemingly small habits on the day to day. So today you ate something you shouldn't have eaten. Well, tomorrow try not to. Or what is the next best thing? Right. So there's always a way forward. I don't believe that there's any situation that's hopeless. There's always a way forward. It's just we work together on finding that path. So if the medication is not working, do I need to increase it? Have you skipped any? Can I create an environment where you feel comfortable to tell me the truth? Like, I'm not judging you. What can we do? Is the medicine making you sick? Do I need to add something else? Or how about talk to me about what you're eating? And then we go look Google. I've done this with patients. Let's look at the White Castle French fries versus Chick-fil-A and see which one has more salt. I had a patient get upset with me because the first day she met me, I told her to give up soda. She's like, you just met me, woman. And I'm like, my bad. So she liked Dr. Pepper. So we agreed on half and half iced tea from, I don't remember where. And we said, looking at the sugar content, if you did this cup, or it's the same size as Dr. Pepper, the sweet ice is less. So we settled on that. Of course, I had to adjust her medicines to adjust for, coverage, and we work our way. So we meet you where you are. Our goal is to walk with you and to encourage you, but don't give up on yourself. We won't give up on you, right? There's always hope. Yeah.
Wow, I love how you're, willing to educate your patient. Like take the time, to Google and look up stuff and, show them the information so they can look it up on their own and then negotiate. I think that's always so important to work with patients. And I think the same thing for our audience, if they're not physicians. I think talk to your doctor, even if you don't necessarily like their plan. I think it's very important to be honest. If you think that the medicine is rubbish, and tell them why you think it's rubbish. So, that's a common side effect. Yes, a lot of people, end up going to the bathroom a lot because of that blood pressure medicine. And we should give you a different blood pressure medicine that doesn't make you go to the bathroom a lot. So I think it's very important to be very honest. And if you're forgetting medications, I think it's important to be honest because your doctor can help you with that as well. Maybe they can switch you to a 2-in-1 combination pill, or they can talk to your pharmacist to bubble pack your medications. But I think that's very important to be honest about, the reality so that we can work with you. I really love how, you're working with your patients and negotiating and working together. That's extremely important. Speaking of things that contribute to our health, I think stress is a big thing that, is not often acknowledged. What do you think about stress and its impact on, causing disease and various medical conditions? And perhaps what are some tips you might tell your patients to help reduce their stress?
What's stress? It's like your body staying in, fight or flight state, like for that period. It's not good long term. So to stay constantly in a fight or flight mode where you're it's not good. Raises your cortisol level. We know that affects a lot of things, affects longevity. So, but the truth is life, like what's the phrase? Life is lifing, right? And so I think it's an awareness, creating an awareness of what stress can do to you. So if you work in a high stress job where there are always tasks, your inboxes are going, your cases are going, and it triggers you, you got to learn to detach. So I've had to talk to clients saying, knowing that stress affects your blood pressure and knowing what it's costing you, how do you think you can adjust to it? For instance, choosing to not be offended. So you have a passive aggressive boss, can be hard, but there's a mindedness to like, you know what? I'm knowing how it affects me. I have to detach. There's some conversations or some statements that don't trigger me anymore because it's not worth my blood pressure. It's not worth my cortisol level going up. So there's a mindedness. That's one. And then two, really, really important to practice self-care. I used to be like, oh, yeah, self-care. But self-care does not mean going to have your manicure done. It doesn't mean going for makeup. It means doing things that you know help you feel better, spirit, soul, and body. For some is praying. Some is meditating. For some is turning off your, like, oh man, sometimes when I turn off my phone or I forget it, I feel good. So some days I intentionally forget it at home. And so what are things or practices that you know help you feel better? May not be a dramatic difference when you do it, but you know over time make a difference so that when you stop it, you can tell. You want to keep doing those things. The self-care is important to dissipate some of that stress. Yes. Even at work, I tell my team, I said that the cases are endless. Like if you had no cases in your inbox, you're out of a job. So it's job security. So when you see an inbox, go, yay, job security. Like that's the mindedness. Like otherwise you just all day. But it's practice. It's practice.
That is awesome. That is so powerful. Mindedness. Like you're right. How are you looking at this, whatever this thing is in front of you? Are you looking at it as an obstacle? Is it neutral? Or maybe you can find the good in it, like another message to respond to. Yeah, you're right. It is job security. If all of us looked at it that way, how much stress will be gone in the world, I think that's really, really powerful. Thank you for sharing that. And with that in mind, I have one more question for you. What do you think is the secret to a good long life?
I do believe that studies have shown that being spiritual increases your quality of life and how long you live. Studies have shown that. And I would be untruthful if I didn't say that. I mean, a relationship with your maker, your purpose giver is, yeah. That's the biggest. That's the biggest. Yes.
Beautiful. I love that answer. I love that answer. And I think there are studies that show that you're right, that people who are spiritual or have a religious service, that they tend to live a little bit longer. So I love it. That is a spectacular answer. Dr. Tolu, thank you so much for being on the show. It's been a pleasure. It's been a pleasure, hearing about how you care for your patients' mind, body, and spirit. For you, it's not just, this is a job, or it's not just about the pills. This is a calling, and this is incredible. Thank you. And with that, how can people find you or reach out to you? I'm sure there's a lot of people here who are like, I need to find her. I want her to be my doctor. Where can they find you? Either online, just to, to hear what you have to share, or how can they find you to be their doctor?
I would say if you go to our website, www.livingspringmedicals.com. That's one way. I'm also on Facebook. I'm on LinkedIn. I'm on Instagram and Twitter. And we do have a YouTube channel as well. If you Google Living Spring Family Medical Center, or just Google my name, Dr. Tolulope Olabintan. You find all the things. Yes.
We will make sure that we put all the links below the show so that everyone can find you. But thank you again. And I want to have you back on the show. I want to talk more about lifestyle. I want to talk more about the mindset. I think this is huge. I would love to have you on again. So we'll make sure that we have you on. But thank you again.
My pleasure. Thank you.